Hello, my name is Mohammed Ghaznavi. I'm one of the interrogators over here. So this is the warm-up session for your role play. So can you confirm your name, please?
My name is Mariam Imtiaz and I'm here. I'm a candidate of OET nursing. I'm here to prepare for my exam.
Okay. As you know that in the warm-up session, you can ask any question if you're having regarding the pattern of the exam. The purpose of the session is to make you comfortable for you and for the audience who will be listening to us. This part is being recorded, but it's not being assessed, right?
Okay,
so first of all, I'm going to ask you some question about you, okay? And this is just for the purpose so that you can be relaxed in the session. So basically, can you tell me about yourself?
I'm a student of OET. I'm basically preparing myself for my nursing OET exam.
Okay. So why you have selected nursing as a profession?
Because it was my father's dream to become an RN.
And what is the reason behind your, what is the motivation that you want to go to UK?
Because I want to go there because it's my dream.
It's your dream, fine.
Yes, sir.
So now let's start the session. You have 2 minutes time for preparation. Have you received the card, please?
Yes, sir.
Okay, please take your time.
Hello, Sarah. My name is Mariam and I'm your attending nurse today. So how can I help you?
Well, I'm quite concerned that why this drip is running. Can you tell me, like, is it going to harm me somehow?
No, the drip is not going to harm you. It's for your betterment that you have an abnormal heart rhythm. That's why we are intervening this drip.
Okay, but you know, like, that's fine.
Am I understandable?
Okay.
So can you tell me about your eating habits and about your food intake? So it will help me to assess more in detail. So can you tell me, please?
Yeah, just to take a piece of bread in the morning.
Okay. So that indicates a poor nutritional status.
But why are you asking this question? It's typically a pure question, like personal question actually.
Yes, I see. But it's for your betterment, for your health and recovery.
How do it help me in my recovery? Because I think it's total personal details. It's my personal habit.
The personal details helps to assess the patient needs and the things that are required in the recovery of the patient. That's why I'm asking you. So there's nothing to worry about that. It will be confidential.
Okay.
Yes.
Okay, that's fine. I do take a piece of bread in the morning, and like at time I usually skip lunch, and I do take maybe 1 piece or 2 pieces of bread in the evening as well.
Okay. So I will advise you to consult to a mental doctor.
Wow, why a mental doctor? I'm not having any mental issue.
You're right. It is quite understandable. You are right, but there is a need. That's why you need to see a mental doctor.
Why is that? You know, I'm not having any mental issue.
Yes, you are not facing any mental issue, but it is important for you as you are skipping your meals. You're not taking the breakfast, and your dietary habit is not that much good as it should be. That's why I'm referring you to a mental health doctor, which will help you to prevent these life-threatening situations.
Okay. Okay.
Did I make it clear?
Yeah.
Is there anything?
Not at this time. Not at this time.
Okay. Yes, sir.
Thank you very much. So let's have a feedback part. As you can see this card on the screen right now, this was an emergency setting, and the patient was already admitted over there. So we should not ask a name directly, and rather than we should not even ask that how can I help you. We have to pick the cue of the patient. If you can see in the card of yours, it's written that the patient was anxious for the drip. So we need to start in this way. I can see that you seem to be a bit concerned. Is everything all right? That is called as a picking up patient cue. So we have to pick the patient cue. Number one, as you have not picked the patient cue, you will be penalized with the false start. Most of the people, they have no idea how to start the card, and they just memorize some lines and start speaking in each and every scenario. So if you have selected a wrong line for this scenario as you have done right now, so you will be penalized with a false start. The plus point I'll also discuss as well, that you remain quite fluent and you try to finish the card, you know, as much as you can. But as you just have started the course, so there are a lot of areas that need to be addressed. Beside false start, never start the sentence with no. You must learn diplomacy in your refusal. Even if you have to start no, Miss Sarah, it's totally relatable that you are quite worried about this trip. However, let me assure you, it's not gonna harm you. It's also no. If you start a sentence with no, it would be a negative, you know, like sign. So you have to show the patient, then make a background always. The patient is admitted over here, you need to tell the background, because there was no background in the conversation, and the audience who will be listening to us, they have no idea like why I should be tough with you in this scenario, but as this is just for the purpose of education. So there was a background, the patient was admitted with irregular heartbeat that you have mentioned, and you need to mention that we are suspecting a condition called anorexia nervosa. Sorry for using the medical term. So in order to regulate or stabilize your body chemicals, we are not supposed to use electrolyte. It's a medical term.
Medical term.
So we just use the body chemicals. You have skipped this part as a whole, but I'm just telling you, if someone can see this card, and if he or she has to practice this card back at home, so they must not use the medical terms such as electrolyte. So you just have to use the body chemicals, so that we can stabilize your irregular heartbeat, so that we can stabilize your body chemicals. For that reason, due to the deficiency in the diet that we are suspecting, you are having the irregular heartbeat. Unfortunately, after admission to the emergency department, I'm glad that with high tone, I'm glad that your body chemicals are stable now. So I'm here for your help. I need to document your history, so that when the doctor will be there, who will be addressing you this problem, so he need to know all this problem. Okay. Moving on to the point that when we have to ask personal question, even diet, smoking, alcohol, these are the personal question. You need to take the permission. After making a background, you can see, okay, do you mind if I can ask some personal question? Okay, let's start with your diet, and can you tell me what do you take in breakfast? So these are the closed-ended question. You have not asked the closed-ended question because these are the specific details. Closed-ended question mean beside the grammatical range that you will add over here, you must ask the specific question. So as this the part of your task was about the diet, and they have not mentioned about the, like you asked about the breakfast, they just have given you an umbrella statement about the diet. So we have to disintegrate ourselves. We show the grammar range. What about your breakfast? How about your lunch? And what you take in your
dinner?
Okay. So basically you can see there are 3 different sentences that we have used in our only one task. So you should show the range of grammar and the specific question related to the task. Okay. When the patient will give you tough time, Mr. Mark, it's totally understandable that your concern and worries. I respect your personal thing. First of all, will maintain your privacy, right? However, if I'm going to educate you that I am just taking the history, it will be helpful for us the treatment. They mentioned this point, right? For therapeutic purposes. So we just mentioned that I'm taking all the I'm documenting all the history, so that it can be further helpful for a doctor, because the specialist doctor, we are not going to use the mental one, because the specialist doctor will be there, who's responsible for managing this condition. And God forbid if you have used this word, that mental doctor, still you have to Mr. Mark, basically you're right, it's not just the people who's crazy. This condition is related to the mental condition, like it's related to the brain. For that reason, this is the specialist doctor who will be there, right? And at the end, always ask for clarity, right? Always ask for clarity. Have I made myself clear? Do you want to ask any question? Then summarize it down, right? Okay. More important thing, do ask about the anorexia nervosa knowledge. Have you ever heard this term before?
Yes.
Do ask about the patient concern. What make you concerned about this drip?
Disease.
First of all, let me show you that it's not going to harm you. Can you tell me what are your concern for the drip? So these are few things that you have to ask, right?
Yes, sir.
I think it was fine with reference to fluency. You were fine, but little bit hesitation was there.
Yes, sir.
But I believe it will be improved with practice, right?
Yes, sir.
Any question that you want to ask?
No, sir.
Thank you very much for your time. Okay, this was OET nursing emergency department card. Though the patient was stable, however, the patient was concerned regarding the drip. So we address the difficulties the candidate could have while doing this card. If you still have any question based on the recording, you can ask in the comment. We'll try to answer those questions as early as we can. Thank you.
My name is Mariam Imtiaz and I'm here for preparation of my OET nursing examination. The experience is wonderful, and it has enabled me to find out my mistakes and made me more clear about the speaking. The mock tests are excellent for your preparation over here, and I would suggest everyone to come over here if you are preparing for your OET exam.